All right, before going in to see the patient, I've made sure to review her medical records. I've gathered any supplies necessary. In this case, I will just be needing my stethoscope. I have verified any safety issues. I've made sure we are in a private location, and I've gathered any PPE necessary. May I come in?
Yes.
Hi there, my name is Lizzie. I'll be your student nurse today. Can you just go ahead and verify your name and date of birth, please?
Taylor Carpenter, 0517-2000.
Thank you. And do you have any allergies that we should be aware of?
I don't.
Are you experiencing any pain or discomfort today?
No.
No? Okay. And then I would just go ahead and wash my hands. And then I would come back in. I'm not seeing that my patient is in any sign of acute distress. Do you know what day it is?
Tuesday.
Where we are?
I mean, it's Monday. It's Monday.
Where we are?
My house.
Who's the president?
Joe Biden.
Okay, my patient is awake, alert, and oriented ×3. I'm not seeing any visible edema. I'm not seeing any cyanosis. I would go ahead and take all of her vital signs. Are you taking any current medications?
No.
No. And I would make sure to go ahead and review her systems as well. So I'm just going to ask you a couple of questions regarding your cardiovascular and respiratory history. Do you have any history of bronchitis?
I don't.
Any asthma issues?
No.
Do you have any recent pneumonia?
No.
Emphysema?
No.
Any shortness of breath?
No.
Hypertension?
No.
Have you had any problems with coughing or coughing up blood?
No.
Any tuberculosis in the past?
No.
Do you experience any fatigue?
No.
Do you have any chest pain
No.
or any edema that you're concerned about?
No.
Do you have any pain or cramp in your hands or legs?
No.
And do you have any past history of surgeries?
I don't know.
Okay, and I'm just going to ask you some questions about your family history as well. Are you a smoker?
No.
Does your family have any history of congenital defects?
No.
Any history of hypertension or diabetes?
No.
Any problems with obesity?
No.
Do you exercise frequently?
No.
Okay, so I'm going to go ahead and start by inspecting her thoracic and respiratory. So I'm looking at the shape of her chest. I'm not seeing any pigeon chest. Her shape looks nice and natural. I'm gonna look at her A&P and transverse. That's looking nice and symmetric. I'm not seeing any barrel chest or anything like that. I'm looking at her skin color. It's nice and pink, normal. I'm not seeing any lesions or anything. Can you go ahead and take a deep breath for me? Okay, her use of accessory muscles looks good. She's using that diaphragm breathing. I would go ahead and look at her breast symmetry. It looks nice. Her breast tissue looks good as well. I'm not seeing any lesions or lumps. Perfect. And then I'm going to move on to some palpating. So I'm going to go ahead and palpate her trachea. It's nice and midline without tug. I'm going to palpate her tactile fremetus. So can you just go ahead and say 99 for me?
99.
Okay, I'm not feeling any severe movement there. I'm going to go ahead and check her chest expansion. Can you just take a deep breath for me? Okay, that's looking nice and normal. And then also I'm going to palpate her chest wall. Do you feel any tenderness? And I'm not feeling any lumps either. Next, moving on to percussion, I'm just going to go ahead and percuss some areas. Okay, I'm not feeling any dull sounds, so that's good. It's nice and hollow. And then I'm going to move on to auscultating. So I am going to start by auscultating her trachea. Can you just take a deep breath through your mouth? Okay, that's sounding nice and normal. It's a harsh, loud sound. And then I'm going to go ahead and move on to her bronchovesicular. So I'm just gonna go ahead and go under your shirt. Just take a deep breath. Your mouth. Okay, can you just go ahead and lift your breath for me? Take a deep breath. So her vesicular sounds nice and normal. It's nice low sound. So I'm going to move on to her back and just check the same areas. Thank you. Just take a deep breath. So all of her breath sounds sound nice and normal. I'm not hearing any adventition sounds like decreased breaths, no wheezes, no crackles, or any stridor. So next I'm moving on to her cardiac assessment. So I'm going to start by inspecting her skin. I don't see any cyanosis, no edema. Her hair distribution looks good. I'm not seeing any lesions. Her chest looks good. I'm not seeing any evident pulsating or deformities. I would look at her jugular veins. They're not looking distended, so there's no JVD, so that is good. Next, I would move on to start palpating. So I'm going to start by palpating her carotids. That's good. And while I'm here, I'm also just going to go ahead and check for a bruit with the bell of my stethoscope. Okay, I don't hear a bruit, so that is good. Next, I'm going to check her radial, her brachial. I would go ahead and check her femoral, which is in her groin. I'll check her popliteal, her posterior tibialis, and her dorsalis pedis. I would check her precordium for any thrill. Don't feel anything. And I would also check capillary refill. I'm looking for anything less than 3 seconds, so that's good. And I'm also going to go ahead and check her skin temperature for good circulation. All right, she's nice and warm. So next I'm going to auscultate her heart sounds. So I'm going to be looking at her aortic, her pulmonic, Erb's point, her tricuspid, and her mitral. So I'm going to start with her aortic. Just lean forward a little bit. Oh, darn. Her pulmonic. I can hear that nice and clear. This is also where you're gonna find S2, and this is the lub sound. Next, moving to Erb's point. Okay, go ahead and lift your breasts, her tricuspid, and her mitral. And this is where you're going to find S1, which is the dub. And while I'm here, I'm also going to go ahead and take her apical pulse. Okay, her apical pulse is about 72, so that's within normal findings. And I'm not hearing any murmurs or anything like that, so that's good. I would go ahead and normalize any abnormal findings I found, which I did not find anything. Your cardiac and respiratory system sounds good, nice and healthy. If you notice any edema, swelling, any strange feelings in your chest, like murmurs or pulsing or anything that's out of the normal, just go ahead and contact your primary care provider. And thank you for your time. The doctor will be in shortly.